and good evening. I'm Melisa Idris.
And I'm SharaadKuttan.
You're watching Consider This, the show where we want you to consider and then reconsider what you know of the news of the day. Now, let's start with news that the Berita national government has recalled two proposed bills. One that would have introduced a two-term limit to the position of Prime Minister, and the second was a bill on external oversight of the police. Now, this was the IPCMC bill on the Independent Police Complaints and Misconduct Commission. So the PN government has now the PN government actually already said back in March that it planned to withdraw the IPCMC bill. But what was interesting was that the withdrawing of the term limit bill, Sharaad, that came as a surprise. It was unannounced, so I think very few people expected it to be withdrawn.
Yeah, I think, and I think the questions that have been asked, especially of the MCMC minister, about this turnaround, I think it elicited an interesting response. It says different government, different administration has different philosophies. Right. That may be, but I think if you cast our minds back to March, there was, and he himself had said that people were asking about the values and orientations of this particular government. He said that he admitted the cabinet was born without a manifesto. He, of course, was part of a government that did have a manifesto. He said there was a good and bad to this. The question is, what's good about not having a manifesto?
Well, what a manifesto allows the public to do is to see whether what's being done is what was promised would be done, right? So not having a manifesto, according to Datuk Sri Saifuddin Abdullah, he said that it's good because that they are not tied down to anything, but bad because, again, the public doesn't know what the direction is going to be.
Right. So, okay, I think that's the larger frame in which you have to put this discussion about why the withdrawal of the two-term limit. It goes back to the kind of analysis and diagnosis of the problems of, previous governments and the 60 years of Barisan national rule, where there was executive dominance. We've had the problem of certain individuals holding on to power for a very long time, because the administration of Tun Dr. Mahathir, 22 years in length, at least in his first attempt at Prime Minister. So that was a solution to a problem, a real problem in Malaysian politics.
So now that the Berita national government has withdrawn this bill, so I think it shows where the values of this government are from a legislative point of view. I do want to give a little bit of time to the new IPCC bill. That's the new Independent Police Conduct Commission bill that was tabled today to replace the IPCMC. And I think it's quite interesting because, according to some experts, this new bill that's being tabled perhaps lacks the teeth that was being proposed by the IPCMC. That there's a difference in this new bill that says that no action can be taken against errant police officers. That the IPCC also doesn't have as much transparency, because apparently those who are being investigated can say, well, this is sensitive information, or it puts police officers would expose police officers investigations.
Yeah, I think, Melissa, again, we go back, and this is a 20-year-long struggle to get us out of a particular form of thinking about the police, and that the police are adequate to police themselves, right? The police can police themselves, and the police have always maintained that they don't need an independent oversight mechanism, and that has been the sticking point. Now, even with the PH government, that first draft of the IPCMC wasn't sufficient, and it went through a consultative process, and all these stakeholders came in, and they strengthened that bill. Right now, this has been completely discarded. We're going back, and the name was also indicative of the changes. So it's not a police misconduct commission. It's not to address problems within the police. It's just a police conduct commission. I'm not sure what the word independent in that particular title actually means, and we'll have to see again, because independence has always been the problem for the police. The police have pushed back on this. They say they're not against reform, but clearly, philosophically, they're against reform that allows for an independent oversight.
I guess the question is, why has this conversation gone on for so long? And what are the stumbling blocks? Why is it so difficult for us to implement police reform, which is going to be a good thing? External police oversight can be a good thing for all parties involved, including the police.
And also, you know, it would align us with best practices internationally. The question, of course, and I think the political scientists might have something of an answer for us, the authoritarian nature of governance in this country for the last 60 years and the important role that the police play in an authoritarian structure. And that, I think, has made the political elite beholden on the police, and there's a kind of synergistic relationship. That is something we're not going to see the end of anytime soon.
All right, that's another conversation for another day, but we're going to take a quick break. After this, we will be speaking to Dr. Christopher Lee, the newly appointed president of the Malaysian AIDS Council. That's all coming up in just a couple of minutes. Stay tuned to Consider This.
It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of the new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
Reformasi,
19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid close conversations, avoid crowded spaces, and avoid confined spaces. We can beat this.
The war on COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus. Be it social distancing, hand hygiene and wearing of the face mask. It's a new norm. Let's not slack. We can do this.
We've done great so far,
novel
but the fight is far from over. We need to be vigilant to keep ourselves and
kalau boleh
kes ni dapat wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't relax.
tidak boleh dikurangkan ataupun
The war against COVID-19 is still on. It is our responsibility to adhere to all the regulations set by our Ministry of Health. We are in the era of a new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid close conversations, avoid crowded spaces, and avoid confined spaces. We can beat this
The war on COVID-19 is not
Hi, you're watching Consider This. I'm Melisa Idris. With me is SharaadKuttan. What has been the COVID-19 crisis? What has the COVID-19 crisis taught us about our capacity to manage infectious diseases? Joining us on the show tonight to help us better understand the resilience of Malaysia's healthcare system and the values underlying our public health policies, we have consultant infectious diseases physician, Datuk Dr. Christopher Lee. He served as the Health Ministry's Deputy Director General for Research and Technical Support and also the National Advisor on Infectious Diseases. Dr. Christopher Lee was also recently appointed the new President of the Malaysian AIDS Council. Christopher, thank you so much for joining us on the show tonight. Now,
very welcome.
Can we begin? With what the pandemic has revealed to you about Malaysia's healthcare system and also our capacity to manage infectious diseases?
Well, I think 2 things come to my mind straight off. Number one, we have institutional memory. I think the initial months, as Tan Sri KPK mentioned before, when we first heard of this outbreak in Wuhan, we got things pretty quickly together because we had the institutional memory of previous outbreaks before. And the one closest to mind would be SARS, followed by H1N1. So many of these things came almost second nature to many of us within the Ministry of Health at that time. I think that served us very well because we had a playbook. We didn't have to things from scratch from the early days. So we had a playbook that we could follow, and that made things pretty easy for us. However, I think this outbreak was very different from SARS, from H1N1, because of two things. Number one, the magnitude of the disruption that it caused, and the new information that came along. It didn't spread the way we thought it would spread, like SARS. It was different from SARS. And the game changer, at least for me, and I think for many of my colleagues, was when we realized that this bug was spreading even before patients became symptomatic. That was a game changer. That was, oops, something happened. And we got to change the way we looked at things. So, and I'm sure you remember during the early weeks and the early months, we were talking about if you have fever, don't go out. If you have fever, wear a mask. If you have no fever, don't wear a mask. But with that input of pre-symptomatic or asymptomatic transmission, the whole ball game changed. And we had to adjust our approach. Now, that also tells us that we keep to real time. We look at the information that's coming in all over the world, and we had the ability to look at this data and take away the noise from the real information. You know, I'm sure everybody was talking about fake news during the early weeks and early months, and everyone, when you heard some information, we would struggle. Is it for real? Is this information validated, etc., etc.? But I'm glad to see that within the Ministry of Health, we did have the expertise and the experience of looking at this data. Now, of course, we did have guidance from international agencies like WHO. So all this, I think, from the earlier outbreaks that we have faced, that helped us a great deal. But
Chris, can I ask you about what strains do you think it put on our existing system? Your involvement in the ministry, that experience. Could you see where the stress points were during this particular pandemic?
Well, we are always concerned about the surge capacity. Could we keep up with the numbers that were coming in? During SARS, we were lucky because the number of cases was pretty small because SARS wasn't as infectious. H1N1, we were lucky because H1N1 wasn't that deadly as such. Most patients were very, very few patients were sick. But COVID-19 was a bit different. It is extremely infectious, and even though the mortality rate over the world is about 5%, when you infect so many people became sick. So that became a burden. So the surge capacity was our biggest concern. And when surge capacity happens, we are worried about beds, about ventilators, and about PPEs. I think in our country, I think we all knew that in the early part of the outbreak, we had problems with PPEs.
Right.
It took us some time to move things around and get the PPEs, the right PPEs to the right people.
Okay.
But over time, I think the situation improved over time.
But it wasn't just about equipment and PPEs. It was also about people, about medical frontliners. And, by all intents, for all intents and purposes, they have done a wonderful job. And I'm wondering whether there's been, sufficient effort to protect their well-being. Have we done enough for our medical frontliners, given, especially in the news recently, there's been a lot of talk about unpaid allowances, about, short contract terms for medical officers. So what can be done better to take care of our medical frontliners?
I think Tan Sri talked about it yesterday or the day before. I mean, clearly it's not right that people didn't get the allowances that they were promised. And I'm sure the administrative side will look into it. No question. That's a no-brainer. Surely people get disillusioned and demoralized to some degree. But that's important. I think we need to get that right. We need to make sure they are protected, their well-being is well looked after. We must walk the talk. I think it's sometimes easy to say thank you very much. We appreciate it. We appreciate what you have done, but we have got to show it as well. Talk sometimes is not enough. But I'm sure they will get it right. Right.
Christopher, what about the question of research? Because, we see many countries really at the forefront, and that's not the Malaysian narrative. The narrative has been the management of the disease within the population, but we've not done very well, or at least we've not shone in terms of the research field. Why do you think that is? I mean, is there something deficient in our research capacity?
I think you are right. Based on other developed countries, we may not be on par with them. I think that one is a given. That's true. But research is going on, and I know for a fact that my colleagues at the NIH and IMR are doing research. But of course, the speed of which the research is done certainly may appear slower. For example, I know there's a team working on vaccines, but our vaccine platform may not be as strong as other more developed countries. So yes, we won't be making new roads in a big way in a short period of time. But you are right. I think research is some place we can push forward a bit faster.
Yeah. What would it take, Christopher, for that to happen? Is it just an investment issue? Is it a talent issue?
I think you've scored on both points. Number one, investment is always important, and not just money, but as well as equipment and things like that. Okay. But the bigger issue for me, I think, would be bringing people with the experience and the talent and capacity to do high-level research. Okay. And this either we train from internally, build internally, or sometimes we may even have to import talent from elsewhere.
So on that note, Christopher, there's this mantra, the Build Back Better mantra. With regards to the Malaysian healthcare system, what is it that you think we need to build back better?
Well, I think we have got most of our, in my mind, and I'm being frank about this, I think we got most of the big stuff sorted out. I do think we need to tweak certain things better. I think speed and thoroughness in the way we do things is important. We need to do follow through better because, of course, in any outbreak, there will be gaps. Things will fall through our fingers. That can happen. But I think we need to be able to see those potential pitfalls and hope for the best, of course. But we must always be prepared for the worst. And sometimes that's important. Hoping that everything works out itself is great. That's good, optimistic. But we must really look at what if things go wrong. And can things go wrong? You know, things always go wrong. Somewhere along the line, things go wrong. The question is whether it's a big stuff or whether it's a small, little, tiny, mini one.
Right. Okay, Christopher, we're going to take a quick break, but please stay on the line because after this, we're going to come back and continue the conversation about your new role as President of the Malaysian AIDS Council. We'll be back in a couple of minutes. Stay tuned to consider this.
We are in the era of the new norm. Face masks, social distancing, and also hand hygiene are just basics. We can do this together, and let's not take it easy.
Reformasi
19 is still out there. Let's do our part in following the SOPs in place so that we can break the transmission. Follow the 3 C's. Avoid close conversations, avoid crowded spaces, and avoid confined spaces. We can beat this together.
On COVID-19 is not over. We should not take this lightly. Let us ensure all steps are taken to avoid the spread of the virus. Need social distancing, hand hygiene and wearing of face masks. It's a new norm. Let's not slack. We can do this.
We've done great so far, but the fight is far from over. We need to be vigilant to keep ourselves and others safe. Wear a mask, wash your hands, and when you're out, keep a safe distance. In fighting this virus, we can't relax, so don't relax.
No, the war against COVID-19 is still on. It is our responsibility.
The Malaysian AIDS Council. Christopher, just going on the same vein as some of the lessons learnt, what lessons has our public health response to HIV and AIDS taught us about dealing with this COVID-19 pandemic?
Clearly, it's a very different outbreak, very different infection altogether. COVID-19 is extremely mainstream, in your face type of mainstream infection. But HIV is something that we know it's under fringe. It affects certain risk population or marginalized population. So involving topics sometimes that the public is not very keen to talk about. So I think clearly that's what major difference. COVID is on everybody's lips now, but HIV maybe not so much. People know about it, but they don't talk about it very much. But I think if there's one similarity, I think would be looking at vulnerable and marginalized groups. I think we knew that in a couple of weeks or months ago, we had issues with migrant workers, documented as well as undocumented migrant workers, and quite a number was arrested and tested, and some were found positive. But I had concerns there. I had concerns that this would drive many of these undocumented migrant workers who may be infected, who may carry the virus, underground. And that would heighten the infection even more. So similarly for HIV, we learned that when the authorities went looking for them, they ran away. And during the early years of the HIV outbreak, especially among IDUs, intravenous drug users, where I used to work in HKL, many of them would be arrested, and they see DBKL or the police come, they'll run away. They dare not come to hospital. By the time they come to hospital, they are so sick. But at the end, when they are really so sick, they do turn up in hospital, and some of them die in casualty, or they die in our wards. So at the end, the outcome is bad all around. Nobody wins. But working through NGOs and also with a change of approach by the public health people and Ministry of Health, things improve over the years. And now the relationship with IDUs and the government, Ministry of Health in particular, has changed, has improved to some degree. And there's more trust. And that's one thing we may learn from the HIV outbreak. When it comes to certain vulnerable groups or marginalized groups, I think enforcement alone cannot do it. It has to be engagement. I understand the law is the law. When we break the law, certain things have to follow. I get that. But I think we can also work on the engagement part, either through a third party, for example, either from NGOs or from CBOs, community-based organizations, to work with these groups to build trust. At the end, we don't want them to fall sick. A patient with HIV dying with AIDS doesn't help anyone. Especially now when we have so many good drugs that we can use to treat them and keep them well for many years to come.
Christopher, one of the conversations, and there's been raised, is that we're now the discussions around COVID and the vaccine in particular mimic some of the early days of the HIV/AIDS epidemic, where there was a lot of talk about the vaccine being somehow a solution, and now we've had more than, I don't know, decades long without a real vaccine, and we've learned to live, as you rightly pointed out, we learned to live with the pandemic and allowed people to live better lives with all the treatments available. Do you think that's more likely a scenario for COVID-19 than a kind of miracle drug turnaround on a vaccine kind of narrative?
The vaccine, I think 3 days ago, Hong Kong University reported the world's first documented reinfection. There were talks earlier about these things happening, but this was the first documented one. And this is of concern. So that means this chap was infected a couple of months ago, and he got reinfected by a different virus. I mean, the same coronavirus, but from a different strain. And that's a bummer. So in terms of whether the vaccine would work. So yes, that would affect us. But having said that, looking at the amount of the warp speed type of vaccine development we are seeing now, I think it's quite hopeful that we will get a vaccine. Right. The question is whether how effective is it and how long-lasting is the immunity. Time will tell. That one we just have to wait it out. But I do agree with you, Sharaad. At the end of the day, I think for the near future, for the next couple of years, perhaps, many countries in the world will have to live without the vaccine yet, even when the vaccine is available. You know, it's a hot commodity. Everybody is buying the vaccine. For sure. And Malaysia may be lower down in the pecking order. That's the reality. So I know the Ministry of Health is trying to work with certain countries to get some access. And I do hope we succeed, no question about that. But I think we must also be realistic that if we don't get the vaccine in the same time the Americans do, or the Japanese and the Australians do, we have to now learn how to live with this virus for a while. And I think I was certainly hoping the government would extend the RMCO. Maybe you can tweak things here, a little bit here and there, but I think we will have to live as if we are in the RMCO for quite a while to come.
Okay.
in my mind.
So the appointment, your appointment as president of the Malaysian AIDS Council, I mean, we never congratulated you and the team for this appointment, so congratulations. But it does come at a very challenging time, especially at a time of COVID, where medical resources, where financial resources are all being diverted to deal with the pandemic. What is your biggest challenge now heading the Malaysian AIDS Council during the time of the COVID pandemic?
Thank you for spoiling my day. Now I'm getting stressed. You're absolutely right. Challenging times indeed, no question. I think money will be a problem. Raising funds, getting funds out there for our partners to get their work done will be a challenge. The government may have less money to move around as well. We hope not, but that may happen. But the other thing that we have, the issue about distancing that we still have to respect. We cannot send our workers out there and expose themselves unnecessarily. Our clients, the people that we work with, the drug users, the men who have sex with men, they may not also be comfortable meeting us. Now, of course, the virtual extension using digital health is something that we are exploring. Some of our clients and risk populations are very open to technology. But unfortunately, there are also certain populations that we deal with who do not have access to this newer technology of digital health. So it will be a hybrid approach. Clearly, we have to go more on the virtual side in terms of it saves money, it saves time, and reach out to more people. But at the same time, we still have to go back to the traditional face-to-face encounters for some of our population. And this, we have to train our staff on the ground how to keep themselves safe. Certainly, we do not want to send them out into harm's way. Our staff falling sick doesn't help anyone.
Sure.
So yes, that's a challenge.
Right. Christopher, the HIV/AIDS pandemic produced a rich vocabulary in terms of thinking about the disease and human society. We think of harm reduction, or we think of the fact that you can live a healthy life with a disease as potentially devastating as AIDS. The question is, what for you would be the success of and measure of our fight against COVID-19? Would it be about reducing deaths? Is it about the lessening the number of positive cases? Is it about testing? Or is it about a balance between the economy shutting down and but keeping things going? What would for you would be the real measure?
I think many countries have learned that, and I think Malaysia, and I'm not privy to this higher level discussions now, but clearly going into another major shutdown, like what we did our MCO, the earlier part of it, is not something the government or the country can tolerate, I think. The important thing now is the minute we have been able to bring the numbers to a controllable level, and there will be clusters here and there, and every day you hear one cluster there, another cluster there. But as long as we deal with these clusters fast enough, life can go on. You and I can still go to the grocery shop. You and I can still go to work. Two of you can go to the studio at the same time and don't have to stay far, far apart. Life goes on with some changes, all right? All of us hate going to the shops and putting our name, taking my sajatra. It's a bit of pain. Right. But we all have to live with it now. But I think we can accept that inconvenience if we can still live our lives. Now, very soon, the school's going to open. Very soon, the exams is going to start. The training of doctors and nurses will continue, and that has been stopped for the last couple of months. Life is coming back to normal. Right. So the important thing for the Ministry of Health, especially my colleagues in public health, is to watch and put good surveillance of the infection, the cases that are around, detect them fast, contact trace fast, isolate them fast, so that it doesn't explode.
Christopher,
and if we keep that going like what we have done so far, you and I may continue to live fairly normal lives.
Christopher, thank you so much for speaking with us tonight. We really appreciate your time and your insights. All the best in your new role.
Thank you.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm SharaadKuttan, signing off for the evening.
Thank you so much for watching, and good night.
Thank you.